Are you a horse rider and getting pain across the lower part of the lower back, also known as the sacroiliac joint? If you are, then I'm going to demonstrate some exercise to help to strengthen and stabilise around that sacroiliac joint. So we're going to work muscles, your core muscles, which are your deep tummy muscles, and your glutes muscles, your buttock muscles, to help to stabilise. Sometimes we see a lot of people in the clinic with sacroiliac problems. There can sometimes be an alignment issue, so it can be one part of the pelvis goes up slightly or rotates. So what we do is we do a full assessment and can assess you, correct that alignment, and then these are the types of exercises you can do to strengthen and stabilise around that pelvis to stop that alignment problem happening again. So I'll just demonstrate the exercise now. So the first one's a bridge. So we come onto your back with your knees bent up. So feet about hip distance apart. With this one, it's really important that you push down through your heels and you squeeze your bottom muscles. So push down through your heels, squeeze your bottom muscles. So you should feel it in your glutes and your bottom muscles. Hold it for 5 seconds and then you slowly lower down. Okay, and again, so squeeze, push through your heels, squeeze your buttock muscles and lift and hold for 5 seconds. And these exercises are about getting these muscles as strong as we can. So what I would say is start by doing 10, but then slowly increase. And what we want to do when we do these exercises every day is just to really get these muscles to fatigue tired. So it might be that you end up building it to 15, 20, 25 reps. But we just want to really feel these muscles working. Okay, so that's the first one for your glutes. The second one is for your core, so your deep tummy muscles, to help to support and stabilise around that pelvis a little bit more. So there's lots of different options here. So the first option is we just lift one leg and then we keep your lower tummy muscles tight, and then we slowly lower down, and then we repeat and then slowly lower. Okay, if you're not feeling this working, then the next level is to lift both legs up. It's just really important here that you keep your back flat on the floor or against the bed, and then you just slowly toe tap and then come back up and then repeat that on the other side. So repetitions wise, again, to start with, we'll just do 10 on each side, but as you get stronger, then you need to increase, and what we're aiming for here is you can feel your tummy muscles fatiguing, so working, yeah, and getting tired. What you should feel on this one, you shouldn't feel it pulling on your lower back. So if it starts to pull on your lower back, then choose the easier option, which is just to start with just doing one leg. And then what you gradually do from there is you do one leg and just halfway down, so then one leg, and then you can go all the way down and then coming back up. And then that's the same with the double one. So you can start just by doing a gentle toe tap, and then as you get stronger, you can go all the way down to straight and then coming back up. But it's really important that we keep your back flat on the bed and you feel your tummy muscles working, not your back muscles. Next exercise is what I call a Superman. So it's again help to stabilise around the core muscles to help support and stabilise around that sacroiliac joint. So on all fours, and then it's just reaching out opposite arm and leg. So hold in for 10 seconds. Okay, and then I'll just show you on the other side. Reaching out opposite arm and leg. Okay, just show you that one again. So we hold it for 10 seconds and we do 10 a couple of times a day. And the next one is a half plank. So come down onto your forearms and we're just going to come up onto your knees there. Okay, and build up, holding for 30 seconds. And we'll do this two times a day. So with the half plank, you should feel it in your core muscles, so your deep tummy muscles. If you're feeling it around your back, then you might need to just reduce the time down. So instead of doing 30 seconds, you do 10, 20 seconds. Do that two times a day. But slowly aim to build up towards 30 seconds and then gradually up towards a minute. So if you are a horse rider and you're getting pain, so sacroiliac joints sort of around the lower part of the lower back, just either side, then we'd always advise you to have an assessment by a therapist first to determine if there are any alignment issues, and then these are the types of exercises you can do to help to strengthen once that alignment has been corrected.